I think it depends on what one's objectives are when it comes to social media. I think, in terms of reaching a wider audience beyond your clinical setting or the community that you are practicing in. I mean, there's nothing that is more important than engagement in social media. We know, for example, that no matter where you are in the world, but especially here in the United States, people with conditions, including cancer and their caregivers and also their loved ones, they're all looking to social media for any kind of guidance at all. But despite that practice, there's so much information that the issue is which information is reliable. And here in the United States, the data always points towards clinicians and physicians as being the most trusted on social media platforms. So whether that's your presence on YouTube or Instagram or TikTok or Twitter, you are reaching a group of people who are searching for information, and you can be the place that points you towards good versus disinformation. And I think that's the critical aspect. But it's also really, really important to understand that social media is not a monolith. And that's just say, because Twitter is where oncology professionals in the United States tend to gather and communicate with each other, is not synonymous with this being the preferred platform in any single community in the United States, but also as you go globally. In fact, if your goal is to address disparities, for example, let's say in cervical cancer, you need to find out where those communities are because they're likely not on Twitter. If you go into Asia, WhatsApp is a bigger draw for conversations and community than anywhere else on the United States. Facebook communities are still very important for a lot of advocacy organizations. So if you limit yourself to a platform because it's the platform you're most comfortable with, then your reach may not meet your objectives. But if your objective is to make yourself available, point people towards good resources, highlight developments in the treatment of the disease you are interested in, there is a place for you on social media.